The American Diabetes Association Outstanding Educator Award this year is going to Jackie Boucher, and she joins me now. Thank you for being here.
Thank you for having me.
So talk to me about your role in education of diabetes.
My background by training is I'm a dietitian, and I've been working with the ADA to help more people with diabetes gain access to information for probably 20 years. Education is a vital role for people with diabetes. Knowledge is power, and so part of what I've been doing is focusing on how can we increase access to that information so people with diabetes have the information they need to manage their disease.
And when you talk about that access to the information, what have the biggest challenges do you think have been in getting that information out, not only to healthcare providers, but to people?
You know, early on technology was more on the provider side, and now patients have a lot more technology on the patient side, you know, wearable devices. They have access on their phones to information, the internet. And I think as clinicians, you know, we only see patients a few hours per year in the clinic. And so part of what we need to do is help them build up the support systems and connect with each other outside of the clinic, in their home and work and community, because that's where people spend the most time.
And when you have that technology that can link the healthcare provider and the patient together in such a way that they can really monitor them better, have we seen an increase in the quality of care?
As professionals, it's very hard to keep up on technology, right? There's so much changing every day. But I think, you know, strategically, if we can help patients use information based on their skill level, their knowledge, their access to the different information, it can help them achieve more positive health outcomes.
There's a lot of information also at the fingertips of the patients now where they can come to a doctor and say, can I have this treatment, or is this option available to me? But at the same time, I feel like there's also some misinformation out there. Has that been challenging?
There are a lot of misperceptions out there about diabetes and what causes it, how you treat it. Part of what you're trying to do is also just educate patients on how to discern all that information. How do you find the most accurate information and use that information to manage your disease?
What do you think the most effective initiatives have been out there?
We're still doing more research on how technology integrates. Obviously, continuous glucose monitors, there's more data around that and how that helps people manage the disease. But there's, you know, growing body of evidence around, you know, using apps. People can integrate trackers for their steps with nutrition information, the support they can get from each other. There's apps where patients can, you know, text pictures of their food and ask questions. There's a lot of different technology that's being tested, and so I think it's all in how we strategically help patients use it.
Technology is changing so rapidly. What are you most excited about having at your fingertips to be able to better educate people and better help them with their diabetes?
You know, what would be really interesting in the future is that a patient might be able to carry almost like a chip or have it in their phone with an app where all of their electronic health record from every different clinic provider they've seen is integrated into one. Integrating all that information into one spot so that you can really get the full picture, you know, a little bit more holistic view of your patients and how they're doing. I know in some of my research with the Heart of New Ulm project, we tried to do that. We were using iPads and laptops out in the community and integrating some of the information, because for people with diabetes, health records often don't easily track different behaviors. And so it helps you get a better picture of nutrition, activity, stress, tobacco, different behaviors that are also part of the disease management.
A lot of great progress. Yeah. Jackie Boucher, congratulations on your award. Thank you, and continuing the great education of diabetes.
Thank you. Thanks for having me.